Assalamu alaikum wa rahmatullahi wa barakatuh. My name is Dr.Amal Nour El Din, and I am a board member of the American Muslim Women Physician Association. Today we're I'm gonna co-present with Dr. Deanna Ayyash, visiting a dentist during COVID, what to look for. I'm very pleased to be one of the board members of the American Muslim Women Physician Association. I have been collaborating with them for more than 10 years. And mashallah, they have an amazing passion towards prevention. So hopefully today we can give you and enlighten you about certain aspects of prevention as well. I would like to say that Dr. Deanna Ayyash was one of my students. And today I would like to say again that I'm a very proud professor of Dr. Ayyash. She's an amazing, talented, wonderful young Muslim woman and a dentist and an achiever. And I'm honored to be co-presenting with her today. أعوذ بالله من الشيطان الرجيم بسم الله الرحمن الرحيم ولنبلونكم بشيء من الخوف والجوع ونقص من الأموال والأنفس والثمرات صدق الله العظيم. We will certainly test you with a touch of fear and famine and loss of property, life, and crops. I don't think any ayah in the Quran will fit to our situation through the pandemic more than this ayah in Surah Al-Baqarah, which explains what Allah subhanahu wa ta'ala is making us go through this year in 2020. But subhanallah, it's to count our blessings and to count what He gave us from before and still giving us. Alhamdulillah for everything. And I know there is fear from visiting the dentist. So let my partner, Dr. Ayyash, start. So please, Dr. Ayyash, start with the first part of our presentation about visiting the dentist office. Can you unmute yourself, please?
Yes. Assalamu alaikum. My name is Deanna Ayyash. I'm a practicing dentist in the Colony, Texas. And I'm excited to present this with Dr. Nour El Din. So in this first slide here, so a lot of questions about whether or not it's a good idea to, go to the dentist at this time. It's one of those it's one of those routine things that we have to do to take care of ourselves. If you can see here, obviously before 2020, we were still having proper PPE. And you can see that it was just it was simply the loops on the eyes, the mask, and gloves, and everything was sterilized. You have autoclave, you have everything that's wiped down between patients, that's the usual protocol. You can see to the right side now, you have double the PPE, you have full, at my office, I'm wearing a full raincoat. You have the face shields, 2 masks, and it's obviously a lot different. You can see in this photo here, that's pretty much what you're going to see, or you should see dentists, especially the general dentists that are actually working in your mouth doing actual treatment where aerosols are involved. You can see this when we're strapped up, we're actually, obviously we're trying to protect ourselves, but then also protect everyone else. There's aerosols in the air. So, this is, the face shield is obviously to protect us as dentists so that, we don't get exposed, so that we don't pass it on to the next patient. In my setting, we have, raincoats that we wipe down with Cavicide between each patient. So, I'm sorry. Okay. So yeah, that's basically the typical, that's usually what you will see is the double mask, the face shield, the full gown, and protecting us and as dentists, and then also of course protecting the patients as well, in the event of any exposure, which has been actually very rare, thankfully. So so this is a question that's, it's often comes up. What is the best option for me if I don't have any non-urgent? What is non-urgent? Non-urgent is you're not in pain. If you're in pain, go to the dentist. There's probably something going on there that you really need to fix. If it's non-urgent, say just a checkup, a cleaning, like what are some benefits in doing that? Of course, you always want to be extremely, if you're the type that's hasn't left the house during this whole pandemic, like, of course, I'm going to say with careful consideration, you want to go and see, if you're going to leave your house, there's always going to be some sort of risk. However, there's, a lot of benefits to that. And then, it's just some things to look out for to make sure, to ensure that you have all the safety when you're going to the dentist during this pandemic. So I say yes with careful consideration. Like I said, if you haven't been leaving ever, if you're very discreet about going to the grocery store, I'm not going to, tell you to just absolutely 100% go. There's always going to be a risk if you're leaving your house of getting exposure to any kind of virus outside the home. So just want to put that out there. But what are some benefits in going during this time? Of course, like, we're all about prevention. Dentistry is all about prevention. If you're going to your routine checkups, you're going to be able to maintain proper oral hygiene. If you have pending treatment that's been there, you want to make sure that stuff is getting addressed before it gets worse. That's the thing with dentistry, and why it's still, nowadays we've come to really, master how to make this a very safe environment for everyone, because we understand that with dentistry, trying to find things before they get worse is the key. Also, aside from that, your insurance benefits, they're not going to, usually they don't roll over. So, it's really, it's also beneficial to kind of use those before it gets too late. And then even if you're not planning to get any treatment done, I know finances are really tight during this time, at least getting a game plan ready so you can kind of be mindful of, your budgeting and what you're planning to spend on for yourself when it comes to oral hygiene and oral care. If you have something like a filling that was pending, you definitely want to get it checked to make sure it's not going to be borderline root canal, because that's going to be a lot more costly in the future. So those are some, pretty big benefits on going to the dentist during this time. So what to expect beforehand? So how do you ensure that this office is following proper protocols? Now, I'm speaking on behalf of the practice that I'm in, and what we do. We've prepared with several meetings ahead of time. I understand every office is different; they have different philosophies. For the most part, as you saw from before, the PPE is going to be pretty similar, or it should be. How do you know that from ahead of time when you're making the appointment? Ask, what is your office doing to stay safe during this pandemic? What protocols are you guys taking? What extra measures are you guys taking? What things to look out for is, my office, we have extra PPE. We're wearing the, N95 masks or KN95 masks with another mask on top. We have shields at the front desk. Everyone's wearing a mask. Like, that's not negotiable. We're wiping down every 2 hours. Everything is virtually touchless. Forms are being, filled out online. Prescriptions are being called in. We're going to have extra forms to screen every single patient, ask them if they've been traveling. Those are the things that you're going to have to, look out for when you're hearing, because I will be honest, some offices, they've just started becoming more strict within the last few months. Some were strict from the very beginning, but that's something that you definitely want to look out for. Like, what are they doing that's differently during the appointment? This is, again, speaking on behalf of the practice I work in. What we'll be doing is that we don't use a waiting room anymore. That's we have everyone wait in their car. To expect, of obviously keeping your mask on the entire time. When you enter, your temperatures will be taken on every single person, even staff from the beginning of the day. My temperature is taken, everyone's temperature is taken. Each patient, as they come in, their temperature is taken. We also direct them to any sink from the bathroom or near the chair to wash their hands. And then we ask that their masks stay on, until they're asked to be removed for x-rays, exam, and then obviously treatment, and then, have them back on. And then after the appointment, we usually escort you to the front. And, if you want to wash your hands again, we have hand sanitizer in every place that you can find, very accessible, scheduling your follow-up, your 6 months. Again, we try to keep everything as touchless as possible. So we will email you the treatment plans. We'll call in the prescriptions as needed. What I also want to mention is if you do have some minor treatment, say you've like a couple of fillings that you need to get done, I always tell my patients, hey, you're here, let's get it all done so that you're not having to come in multiple appointments. Try to keep everything concise and make this a bit more beneficial so you don't have to keep coming in or leaving the house if you don't feel comfortable with that. So that's something to be mindful of too. So that's what we've been doing. That's a lot different than how we started before the pandemic.
Okay, I believe it's gonna be my turn. And I'm gonna talk about some daily preventive strategies. And as we mentioned earlier, that's always the goal of the American Muslim Women Physician Association. And actually, this is my area of expertise, the prevention strategies in dentistry. So when we say prevention, our goal would be to prevent decay from happening. Our goal is to prevent gum inflammation and to prevent erosion. I believe a big number of people these days know what is erosion, which is so different than decay. So let me just touch base about certain daily practices that we can embrace so that it can prevent all of those three. So usually it's going to be in 3 areas: diet, oral hygiene, and water. So let's speak about diet. Many patients just don't absorb and don't digest, don't accept if the dentist just tell them, stop drinking soda, stop eating sweets. This is tough. This is not practical. And they would ask you, do you expect me to stop drinking soda and eating sweets? Actually, not. We will give alternatives. We will give so many options that the patients can choose from, and we can even give a little bit of techniques that the patient can use so they can encounter the effect of the sweets as well as the drinking soda. And always remember something about diet. It's all about what do you eat and how frequent do you eat it. That's the goal behind the diet. And I know when we hear the word diet, it's about being slim and good fitting. Also, today we are talking about from the dental perspective and dental prevention perspective. So when we talk about diet, I want to tell you that the American Heart Association recommended that for the women, the maximum should be 6 teaspoons of sugar. 6 teaspoons of sugar for women per day. How about men? For men, it is 9 teaspoon sugar of sugar for men. If you imagine the 20-ounce Coke has 15 teaspoons of sugar in it. We need to always make this connection if we are trying to avoid being in a high risk zone with developing decay in our teeth, or having erosive lesions, or having plaque buildup and gingivitis, or I'm sorry, the inflammation of the gum, which is gingivitis. That's the term that we use. So we need to think about our diet. There are surprising sources of hidden sugars. It could be in the pasta sauce, granola bars, yogurt, the instant oatmeal, the salad dressing. It's filled with amount of sugar that even exceeds the 6 teaspoons that we're supposed to have daily as women. The cereal, the energy drinks, the coleslaw, the bottled tea, the dried fruit, ketchup, all of this. So I want you to have a look here and look at and imagine the ketchup that we have in per serving. It has 1 tablespoon of sugar, and the pasta sauce 3 tablespoons. Look at the yogurt and the amount that they put so that it can enhance the taste. That's what they use. And these sugars, unfortunately, it's the refined, or what we call it, the added sugar. It's not like the natural occurring sugars that we as dentists recommend the patients to have it in their toothpaste, to have it in their gum, even the lozenges they are using, like the xylitol or sorbitol. These are the good ones. So the American Heart Association recommends that you can drink carbonated cola, for instance, but it has to be 3 per week. It cannot be more than this. It shouldn't be more than this. And yet, when you take or consume these carbonated drinks, you need to do other stuff with your oral hygiene, like drinking with a straw instead of just drinking directly from the cup. It will minimize the area of contact over all the teeth. We will ask you to rinse your mouth with some water to avoid coating of all your teeth for a prolonged time with carbonated sweetened drinks. We will ask you also maybe to drink your Coke with the meal instead of just drinking it by itself. If you want to drink Coke, just drink it all at once within maybe 10 minutes and you're done. Don't drink it over the day and sip on it along the day. And these are some of the practices that will help us, giving you a tip of, okay, you can keep drinking, just minimize the number, reduce it, but use these tips so that you can avoid the very drastic effect of drinking soda. The frequency is very important. So if you have an Oreo packet and you are consuming this in 30 minutes versus only eating this Oreo over the day, throughout the day, actually, we explain more to the patients, and maybe not right here because of the time of the presentation, but usually these, once we eat something sweet, the acidity of our saliva drops really big time, and the drop in this acidity will lead to decay. For this acidity to go back and have a good saliva that is not very acidic, that does not affect the teeth, we are talking about a minimum of 20 minutes up to 1 hour for the acidity to go back. So if we keep eating every 5 minutes, every 10 minutes, we are not allowing our saliva to become neutral and go back to its good range. So we need, if we are eating sweet, or if we are drinking a sweetened drink or carbonated drink, just do it real quick. in a matter of 30 minutes and get done with it. And that's what I advised in the previous slide. If you're drinking soda, just drink it immediately and don't sip on it all day long. What are the good foods? And that's the question all the patients ask. And we do have flyers, we do have brochures about this, and the dentists know about this very well. If you ask, or the dentist will have this routine in their offices that they instruct you about those good things. So when you look for a chewing gum, for instance, look for the ones that has xylitol, like Spree, like Orbit, like Trident, but had the xylitol in it, xylitol or sorbitol. It's a sugar substitute. It's a sugar substitute, natural, and it cannot be used by the bacteria that decay our teeth. So it's a good deal. You will get this the sweet taste that you want, but it's not going to affect our teeth. The proteins, the fats, fresh fruits, vegetables, daily products, dairy products, as well as cheese. We ask the patients to eat cheese. When we ask the patients, do you eat cheese or drink milk? And they say no. So they are lacking a very important protective factor, which is cheese and milk. And that's what we advise the patients to use and to consume. It will reduce the potential to develop decay. If we look here, we can see like a list of really, excuse me, a list of things that we need to avoid, like the ones that I mentioned from before. And also we can snack on really good, like clean meat, proteins, legumes, seeds, nuts, as well as fresh fruits and vegetables. Peanut butter is one of the most healthy ones, but you need to shift to the natural one instead of having the ones that has the added sugar in it. It's not good. And if you want to eat carbs, you have to combine it with other foods that is not really, we call it cariogenic. It's not really decaying your teeth. Try to eat less carbohydrates, try to eat less sugar, try to drink your soda with the meal instead of after the meal or before the meal. Have those sticky foods immediately, brush after them. We don't want a sticky candy to be in our teeth for a prolonged time. It's fine to eat it, but just get rid of it, clear it from the mouth as early as you can. The sugar-free gum will stimulate saliva. Saliva can protect our teeth. It is a very profound tool to protect our teeth. So we have plenty of measures that we can ask the patient to do so that they can protect their teeth from the diet perspective. How about the erosion? What is erosion? As you can see right here in this picture, this soda really melts down our teeth. This is the erosion where you see the teeth in this shape. This is not decay. And some people get confused. Is this decay? Why my teeth are falling apart? And this is due to this soda. It is very acidic. It's like the acidity that comes out from the battery. If you imagine the battery, if you taste it, how acidic it is, that is the one in the sports drinks, in the soda, any carbonated soda. It is very acidic, and it will lead to wash away the protective layer, which we call it enamel. It washes away, and we, unfortunately, we cannot rebuild it. We cannot restore it. And we have all of these drinks that you see, anything that is acidic, this is the detrimental effect. In the past 15 years, I have seen this happening on and on and on nonstop. And again, same measures as I mentioned. Once you drink any citrus or acidic beverages, sports drink, salad dressing, herbal tea, there is an acid reflux, and people who gag and vomit all the time, they need to clear this from their mouth by swishing water, rinsing water, drinking milk. It's very important to neutralize the effect of this acidity in the oral cavity and in the mouth. This is a cool app called Foodicate. A parent invented this because they wanted to control the amount of sugar consumption with his kids. You can tell what is the amount of sugar in each of those products that you're using and make a wiser choice. The oral hygiene, I will leave it to Dr. Ayyash to talk about the oral hygiene. Dr. Ayyash.
Thank you, Dr. Nour El Din. That was great. Really good information to take on and make segue towards the oral hygiene part. So oral hygiene, I get a lot of, questions from patients. I get a range. I see patients where the hygiene's could be a lot better. And then I have some where it's a little bit too aggressive. So what I mean by that is, if you're, we always recommend soft bristle toothbrush, always. Medium hard is way too much. And we also, recommend, replacing that toothbrush every 3 months or after you get sick. So if you've had a virus or strep throat or something, do switch your toothbrush always, because that stuff will sit and reside in the toothbrush there. And then a portable toothbrush, you always want to keep that at hand wherever you go. Cleaning, rinsing thoroughly. Clean around the toothbrush, make sure everything's just is bacteria free, keep it in the open air just so that it airs out. I even recommend an electric toothbrush. It does a lot of the work for you, again, with soft bristles only. And then, just basic flossing once in the evening, and that's it. Circular motion, nothing too aggressive. We talked a little bit about the erosion from foods. The last thing you want is to also cause extra recession and sensitivity on your teeth because you're brushing too aggressively. So that's definitely something to keep in mind there. And the toothpaste situation, I get questions about that too. It's all marketing. As long as there's fluoride in there, you're going to be fine. And then you're removing the plaque. That's essentially the essence there. The fluoride is just for that extra added protection that's very helpful and useful. I think everyone's different method. I like the process of using mouth rinse first, flossing, and then brushing, so that you can spit and not rinse out the toothpaste, because you can keep that extra, like, just super, super thin layer of toothpaste. Of course, spit as much as you can, but that protection from the fluoride is going to go a long way to keep your teeth resistant to decay. Preventive 5000 is it's a boost of fluoride. I recommend this for pretty much any patient. Even if you've had a history of fluorosis, you're always going to need more fluoride. Right off the bat, if I see, you're just prone to decay, or if, maybe your genetics isn't helping you out much, this is always a helpful toothpaste that I like to recommend. It is prescription based. So, ask your dentist to see if you can get a prescription for this. I know there's a generic brand for it, but it's usually, I call it a fancy Colgate, but it's only through prescription. And with the same instructions apply, brush for 2 minutes, spit, don't rinse. And make that like the last part of your oral hygiene care in the evening. So for water source, I always like to, as far as like figuring out where is the decay coming from, of course, habit is the first thing. Diet, you know, as Dr. Nour El Din mentioned before, that we stress on that because that's going to be a big deal. But for Dr. Nour El Din, she wanted to talk about the water source and kind of
Yes.
educate on how that's helpful for us to keep teeth strong.
Okay, so the water source, as Dr. Ayyash said, we always have the two options: the tap water as well as the bottled water, and we've seen in the past maybe decade that a big number of patients and a big number of persons, not necessarily being patient, just shift towards the bottled water. It's a big thing, and we have to be very aware and very attentive of what's in our bottle. Tap water, it is adjusted by the city, adjusted by the state. It has all the necessary ingredients like the fluoride that we need in a specific safe amount. So ingestion and drinking this tap water will help to give us what is needed, fluoride, to protect our teeth and to resist the decay. And it has been found by research, clinical research, as well as lab research, as well as epidemiological research, that the communities that drink tap water, fluoridated tap water, definitely has less prevalence and less occurrence of decay. Now, let's come to the bottled water with the choice of people. I would like all of you to think and pick what we have among these bottled water. This was a research that I did with one of my students 5 years ago, I believe 5 or 4, where we got all of these brands from Dallas market and from different places, and we conducted a search for what is the amount of fluoride in it in the lab. We tested the amount of fluoride, we tested the acidity, we tested the pH of these waters, and also we tested the cost. How much is it gonna cost us to purchase such bottle? The fluoride was very important to see if I'm drinking only this bottled water. I would like to see some fluoride in it. Otherwise, the patient would be high risk to develop decay in the future, or he will come with decay because they are not drinking bottled water. How about the acidity and the pH? If it is acidic, this is not good. I don't want something to be acidic in my mouth always and continuous. And also the range of price. If I'm asking the patient to just consume the expensive ones, is it doable? Can they do this or cannot? These were all questions that we wanted to ask and wanted to have an answer for. And this is actually what we found. It was very interesting that all of us consume Zarka, Niagara, Kroger, Great Value, and we found no fluoride in it. We found it to be very acidic with a critical pH less than 5. And you need to know that the tooth dissolves at 5.5. The tooth starts to dissolve and lose its protective layer, the enamel, and starts to decay at 5.5. So this is less and more acidic that we don't want to get there. And these bottled water are in this range. And as you go up, I'm not going to mention every brand, but as you go up, reaching here, it was the most costly bottled water, but it had actually an optimal amount of fluoride, the amount of fluoride that we need. And the pH was more than 6, which is neutral. And some of them, the pH was 10. And these are the ones that they have in it. Antioxidant, very good for your body, very good for your blood, very good for your bones. And we ask the patients, if you're not gonna combine the tap water with it, please invest and get at least this category 4 We have this brochure in our dental school, and we show it to the patients, and they take a picture of this to purchase the water that they need. Lastly, here it's about the clenching, branding, and what's happening in the patient's teeth. And I will leave this to Dr. Ayyash to address this and talk about her experience with what's going on with these stressed patients.
So what I found actually when I've since the after opening back up with during this pandemic, what I found that was very interesting is, of course, we're in very a high amount of uncertainty, stressful times. And what I found with patients is there's just a rising epidemic with clenching and grinding. And I even have patients that are like, I've never had this issue before, but I'm noticing that I might be grinding my teeth, or I wake up in the middle of the night, my teeth are just kind of locked together. Of course, just as a screening, functional dentistry is really important to me. So I always ask from the get-go, do you experience any clicking or popping with your jaw? If there is, then it's more often than not, it's going to be tied to some kind of grinding or clenching issue. If, unless there was some kind of previous history of trauma, it's mostly going to be caused by this. And you can see in these pictures in front of you, the extreme repercussions to not having this managed. And you can see on the picture on the bottom right here, you can see that the full structure of teeth, and then before look and what it looks like, you're losing a lot of the dimension of your bite, and that causes a lot of obviously your bite level is going to be compromised. I can't even imagine what's going on in your temporomandibular joint, or TMJ. So, when you're losing a lot of that dimension, you're looking at full mouth reconstruction situation. So, this is something that I try to look out for before this all happens. So, in the next slide, so these are mostly grinding cases. And the next slide, you'll see the clenching. So what I like to look out for, so I am a clencher myself. I do have a night guard. So I try to educate myself on this and try to protect patients from dealing with any the consequences that follow when they're not addressed. You can see, so, the difference, what I'll look out for, obviously, grinding is a lot more easy to see. You'll see the flattening of the cusps, the wear is pretty obvious. I can even see it on the x-ray, just like the flattening. Of course, it's better to get it before it gets worse. You can't restore that once it's gone. It's kind of like the erosion that we talked about before. So with clenching, what I find is that, typically the cusps are more or less intact, but you'll start to see reactions to, around the gum line. You'll start to see recession, and recession can be caused by a numerous amount of factors. One I mentioned earlier was aggressive brushing, but then sometimes you'll notice that there's recession on some teeth and it's not on the one next to it. It's not like you're brushing that one more than the other. So there's probably an issue with very heavy occlusion or heavy bite on that tooth. Other options to address it would be something like Invisalign or braces to make sure your teeth are in the right alignment. But above all, you want to do something about that, because that recession, once it's gone, you can't really get it back. When it gets really extreme, you have on this picture right here in the middle, little divots at the top of the gum area. That's called abfractions. So, and that's not from decay, that's from a heavy bite. On the far right corner, on the far right pictures on the upper and lower, what I'll also look for. So first thing I mentioned earlier, I'll ask, do you have any clicking or popping in your jaw? And then I'll also kind of do a full screening of, checking to see the jaw around the gum line. How does the bone look? And what I tend to notice is if there is a strong bite going on without you realizing, you're going to have extra bone deposit around that area. I'm going to find very strong masseter muscles, very strong cheek muscles. So I'll give them guidance on how to keep that from getting worse, because it can get worse, if you can see on the bottom. And I'll, have them figure out if are they doing it during the day because it's been stressful times? Are they doing it at night? The daytime is a little bit more difficult to manage. I would, advise that they, keep your lips together, teeth apart, have your tongue rested on the roof of your mouth, keeping your teeth just hovering over each other. The nighttime fix is right up here. It's just a night guard. And I'll just, I even will advise maybe make one for the bottom so that you can maybe wear it during the days if you're working at home, and you don't trust yourself to stop doing that. So this is a much less expensive fix than, say, getting crowns on every single tooth or getting a gum graft because you were dealing with so much recession now. So I put the Pronamel up here because I find that Pronamel is very helpful with any areas of recession. I even sometimes advise using it as like an ointment, or just like a paste, and just kind of place it on areas that are, that you've had recession. Worst case, if worst comes to worst, I'll do a filling on it. I don't like doing that, but so I do advise the Pronamel. I advise, I stress getting a night guard, and then also just being mindful of your habits during the day, because so you can see that all causes extra sensitivity, extra soreness in the face. And the only way to really fix that is to keep it from getting worse. So I did want to bring that to light, because that's an epidemic that I'm seeing even more so because of the stressful times that we're going through. And I think that ends our presentation.
Yes.
So yes, and so we'll have the floor open for Q&A, and there's a chat option. So if anyone wants to just type in a question, and we'll gladly answer.
So Deanna, do you see the chat, right? Because I'm the host, so I don't see it. Okay.
Yeah, I see it.
Okay, we will give it a couple of more minutes. Maybe we were so explicit, Dr. Ayyash, that no one has questions.
Yeah, very thorough, hopefully. So I got a question: if deep cleaning hurts, what should I do? So with a deep cleaning, I know sometimes a regular prophy and a deep cleaning can be mixed, because a prophy can feel like it's a deep cleaning. Traditionally, a deep cleaning, deep scaling, it would require numbing if it's truly a deep cleaning. So so ideally it shouldn't hurt you. You would feel pressure from the cleaning, but you should be numb enough with local anesthesia and feel comfortable to endure it. Even if it's a regular cleaning and if it's not comfortable, you can request anesthesia, or at least topical anesthesia, like something to make sure you're comfortable. And do let your dentist know. I have patients that do request even just a little bit of numbing if cleanings are not comfortable for them. So so it shouldn't hurt. I mean, you have options you can explore with your dentist.
Yeah, and if there is a sensitivity afterwards, so that's about hurting when you are in the dental office. But if it is there is sensitivity afterwards, the dentist should apply fluoride varnish on the teeth after you're done with everything. And when you leave home, you won't feel this sensitivity that comes following the.
Yeah, I like to I'll prescribe the Prevident. I'll also, if they don't want the Prevident, I will advise getting Pronamel toothpaste. I really like that toothpaste. It's great for sensitivity, and that sensitivity goes away after. I mean, you're just imagining you're scraping off that top layer, so you are going to be more vulnerable, if you will, for just a few days. I recommend like a saltwater rinse. And then, you know, using Pronamel toothpaste or a Sensodyne, and then the fluoride varnish, that'll really help with the sensitivity. It should subside after a week or so. So be mindful, cold drinks, things like that's going to be a little bit tender. But that'll, you know, as your teeth remineralize with your natural saliva, that should go back to normal in the way it was before.
So I read in the chat that the question was about afterwards. So like what Dr. Ayyash said, either over-the-counter hypersensitivity toothpaste, or the dentist before you leave can apply the fluoride varnish to you before you leave the office, and this will do the job of blocking any sensitivity. We are doing very well with the time, so we still have 3 more minutes for any more questions. So let me say this in a nutshell, because of so many relatives and friends, they come and say, we're afraid, we don't like to go to the dentist. In the meantime, as Dr. Ayyash mentioned, if your dental office has everything in place, all the precautions are being taken, and you ask questions, what do you do to protect your patients, and they will tell you over the phone, you can go, and you need to know it's going to be one of the most protective places, because the dentists themselves are really protective for themselves. So when you go, everything will be good and safe for you to go. Do you see questions, Deanna?
I don't see questions, actually.
Okay, let me stop this share.
Okay, so
okay,
the question was, it is safe to go to the dentist now, as I've not seen one since COVID. At this point, after, you know, after months and months and months of this, yes, I would say it is safe. Like I said before, as a disclaimer, if you're not leaving your house at all, again, there's always going to be a risk because you're leaving your home, where, you know, you're most safe. But I will say, just from since we've opened back up in May, there hasn't been any, I mean, alhamdulillah, there hasn't been any transfer of any cases between patient to doctor, or assistant to patient, or vice versa. Like, there hasn't been any cases in that way. If there was any outbreak, it's from outside the office, like from social events or from like the house or something. But I mean, the offices have been pretty good. So we actually anticipate, we're actually hopeful that if there was going to be any other shutdown to come soon, that dental offices will probably not be part of the category to shut down, because it's been proven to be very safe. And next question was same day implants. So, you know, everyone's method is different. With the way that implants that I'm familiar with, where my office does it, is there's the immediate implants where you're immediately replacing a tooth with an implant on the same day, with the actual screw on the same day that you pull the tooth. Or you wait 4 months post healing of when a tooth was extracted, and then you place an implant. Now, both healing times require 4 months. So if you did an immediate implant, you know, regardless, you put the implant in, it's going to take 4 months of healing. Or like I said before, you pull the tooth, wait 4 months for the bone to completely close up and heal, and then you put the implant you made another 4 months before you take impressions and get crowns done. Now, I'm not sure if there are some offices that put a crown immediately. We don't do that just because we want to make sure that the implant is completely healed and intact, because that's part of the follow-up before we proceed. So we get the clearance from the oral surgeon or the periodontist, the gum specialist, to say, okay, like the implant's looking great, it's healing beautifully. Go ahead with the restorative part, which is my part, where we put the crown on. So not sure if that's answering your question, but same day would be immediate, and those are pretty good if you are a good candidate for it and you have enough bone for that. But the specialist would know that when they examine you. And then how bad is ice cream for you? Ice cream, Dr. Nour El Din, I would say it's like any other treat. It dissolves, which is nice. So it won't stick to your teeth like bread, but in one setting, always, it's the frequency. If you're licking on the same popsicle for the whole hour, for the next 2 hours, you're on the same, that's going to be bad for you. But if you wanted to add anything about ice cream.
Yeah, there is always one aspect of the ice cream. Once you hear this, it's not about being the sweet part of it. It's being very cold. So some patients or some people, they feel pain eating this ice cream. And if they do it frequently, it's like you are actually aggravating your teeth constantly. If you're eating ice cream 3 times a day and it always hurts, and you keep doing this every day, you will end up with something going on with the nerve in your teeth. So you have to make a compromise every now and then, an ice cream that you can withstand and it's not that sweet, or even if it is sweet, you're done with it quickly and you drink water afterwards, you clean your teeth or brush your teeth, you're good. It's not a big deal.
And I wouldn't chew it. Chew
that
that will hurt. And no chewing ice. While we're on that topic.
A lot of people nowadays chew ice.
Yes, do not chew ice.
Yes.
Check your iron levels if you feel like you have to chew on them. So chew on ice. So yeah.
Okay, I believe we don't have more questions. And thank you so much for being with us today. I know it's the end of the Thanksgiving break and many people are very busy with their families. And thank you, Dr. Ayyash, for taking the time and co-presenting with me, and thank you, American Muslim Women Physician Association, for giving us the opportunity to educate the community about something about prevention and going to the dentist office. Thank you. Salam alaikum.
Salam alaikum.